Study section 13. Psychosocial care in pregnancy. Introduction. In the previous study section, you have learned about the changes and adaptation in pregnancy and the physiological changes in pregnancy. However, the presence of the newborn in the home calls for a serious adjustment in the family, and this starts from prenatal period. If the pregnancy is expected, the family adjusts to it easily than when the pregnancy is unplanned for. In this study section, you will learn about the psychosocial changes in pregnancy, diagnosis of pregnancy, objectives of prenatal care, and process of prenatal care. Learning outcomes. At the end of this study section, you should be able to 1. Explain the psychosocial changes in pregnancy. 2. Discuss the diagnosis of pregnancy. 3. Highlight the objectives of prenatal care and process of prenatal care. The psychosocial changes in pregnancy. Most women are delighted even when the pregnancy is unplanned. However, the couple are faced with impending new responsibilities, practical, financial, and its effect on their independence. It is a period of great transition, especially in the life of the woman, which involves not only major social and economic and emotional changes, but also acquisition of a new identity, new role, and skill. Family relationship is reappraised when the woman gets pregnant. In some cultures, pregnancy involves giving up one's job. This leads to reduction in the family income, and the woman becomes more dependent on her partner. In some, the couple draws closer, while in some, it may be the beginning of conflict. It is worse if the pregnancy is unplanned and unwanted. Some women may feel they have lost control of their babies, and this can cause great distress. In some cases, they need helpers in the home. They will need to readjust their living structure to meet with the demand of the new baby. A caring and considerate husband plays a great role in the stability of the pregnant woman. It is always good if husband takes interest in their wife's well-being, especially concerning nutrition, rest, and recreation. By this is meeting her psychological needs, and by that demonstrating his protective role for her welfare. The discomfort of pregnancy may make her irritable sometimes, but the husband should bear with her. Husbands are encouraged to attend classes on preparation for labor so that he can give his emotional support. Husbands also provide for the needs of the woman, wives generally. Diagnosis of pregnancy. The diagnosis of pregnancy requires a multifaceted approach using 3 main diagnostic tools. These are history and physical examination, laboratory evaluation, and ultrasonography. Currently, physicians may use all of these tools to diagnose pregnancy at early gestation and to help rule out other pathologies. History and physical examination. The diagnosis of pregnancy has traditionally been made based on history and physical examination findings. Important aspects of the menstrual history must be obtained. The woman should describe her usual menstrual pattern, including date of onset of last menses, duration, flow, and frequency. Items that may confuse the diagnosis of early pregnancy are an atypical last menstrual period, contraceptive use, and a history of irregular menses. Additionally, 25% of women bleed during their first trimester, thus further complicating the assessment. Be alert for rising human chorionic gonadotrophin (HCG) level and empty uterus observed on sonograph, abdominal pain and vaginal bleeding, because this may signal an ectopic pregnancy. Ectopic pregnancies are the primary cause of first trimester maternal mortality and should be diagnosed early before the pregnancy ruptures or the patient becomes unstable. The classic presentation of pregnancy is a woman with menses of regular frequency who presents with amenorrhea, nausea, vomiting, generalized malaise, and breast tenderness. Upon physical examination, one may find an enlarged uterus after bimanual examination, breast changes, and softening and enlargement of the cervix. Hegel sign observed at approximately 6 weeks. The Chadwick sign is a bluish discoloration of the cervix from venous congestion and can be observed by 8 to 10 weeks. A gravid uterus may be palpable low in the abdomen if the pregnancy has progressed far enough, usually by 12 weeks. Currently, through the use of chemical assays and ultrasonography, physicians are capable of making the diagnosis of pregnancy before many of the physical signs and symptoms are evident. Laboratory evaluation. Several hormones can be measured and monitored to aid in the diagnosis of pregnancy. The most commonly used assays are for the beta subunit of HCG. Other hormones that have been used include progesterone and early pregnancy factor. The cytotrophoblast and synthotrophoblast each secrete a variety of hormones that include, but are not limited to: 1. Goitrophine release hormone. 2. Gonadotropin releasing hormone. 3. Tryptophan releasing hormone. 4. Somatostatin. 5. Corticotropin. 6. Human chorionic tryptophan. 7. Human placental lactogen. 8. Inhibin/activin. 9. Transforming growth factor beta. 10. Insulin-like growth factors 1 and 2. 11. Epidermal growth factor. 12. Pregnancy-specific beta-1 glycoprotein, placental protein 5. 13. Pregnancy-associated plasma protein A. To date, no commercially visible tests that use 3 hormones have been made available to aid in the diagnosis of pregnancy. Beta human chorionic gonadotropin (HCG) is a glycoprotein similar in structure to follicle stimulating hormone (FSH). Luteinizing hormone (LH) and tryptophan (HCG) is composed of alpha and beta subunits. The alpha subunit of HCG is similar to the alpha subunit of FSH, LH, and tryptophan and tryptophan. The 3 beta subunit of HCG differs from the others in that it has 30 amino acid types of the COOH terminus. 3 beta subunits are degraded by macrophage enzymes in the kidney to make a beta subunit called fragrance, which is primarily detected in urine samples. The beta HCG subunit is present in the syncytial layer of the blastoma Hyperlacosylated HCG is a form of HCG produced by invasive cytotrophoblast cells in early pregnancy and implantation. HCG messenger RNA is detectable in the blastomeres of 6 to 8 cells embryos at 2 days, but cannot be isolated in culture medium until 6 days. The detection in maternal serum and urine is evident only after implantation and vascular communication has been established with the decidual by the cytotrophoblast 8 to 10 days after conception. Optimally, tests used for early pregnancy detection should be able to recognize all forms of intact HCG, including the 3 beta subunit and the beta core fragment. Currently, 4 main HCG assays are used. 1. Radioimmune assay. 2. Immune uridometric assay. 3. Enzyme-linked immunosorbent assay ELISA, and 4. Fluoroimmunoassay. Take 2. 4. Fluoroimmunoassay. Ultrasonography. Ultrasonography, also known as ultrasound, comes from a machine that creates an image of the inside of your body. It shows what your baby looks like while still inside your womb, uterus. A pregnancy ultrasound is an imaging test that uses sound waves to create a picture of how a baby is developing in the womb. It is also used to check the female pelvic organs during pregnancy. The average number of ultrasound varies with each pregnancy, should only be used when medically indicated. An ultrasound, also called a sonogram, can help to monitor normal fetal development and screen for any potential problems. Along with the standard ultrasound, there are a number of different, more advanced ultrasound, including a 3D ultrasound, a 4D ultrasound, and a fetal echocardiography, which is an ultrasound that looks in details at the fetus heart. Why is a pregnancy ultrasound needed? An ultrasound can be used for a variety of reasons during pregnancy, depending on the stage in which it is done. Your doctor may order more ultrasound if he or she detected a problem in a previous ultrasound or blood test. Ultrasounds may also be done for non-medical reasons, such as to produce images for the parents or to determine the sex of the baby. While ultrasound technology is safe for both mother and child, healthcare practitioners discourage the use of ultrasound when there is no medical reasons or benefits. In the first trimester of pregnancy, weeks 1 to 12, ultrasound may be done to 1. Confirm pregnancy. 2. Check the fetal heartbeat. 3. Determine the gestational age of the baby and estimate a due date. 4. Check for multiple pregnancies. 5. Examine the placenta, uterus, ovaries, and cervix. 6. Diagnose an ectopic pregnancy when the fetus does not attach to the uterus or miscarriage. 7. Look for any abnormal growth in the fetus. In the second trimester, 12 weeks to 24 weeks, and the third trimester, 24 weeks to 40 weeks of birth, an ultrasound may be done to 1. Monitors the fetus growth and position. 2. Determines the baby's sex. 3. Look at the placenta to check for problems such as placenta previa when the placenta covers the cervix, and placenta abrasion when the placenta separates from the uterus prior to delivery. 4. Confirm multiple pregnancies. 5. Check for characteristics of Down syndrome, normally done between 13 and 14 weeks. 6. Check for congenital abnormalities or birth defects. 7. Examine the fetus for structural abnormalities or blood flow problems. 8. Monitor the levels of amniotic fluid. 9. Determine if the fetus is getting enough oxygen. 10. Diagnose problems with the ovaries or uterus, such as pregnancy, tumors. 11. Measure the length of the cervix. 12. Guide other texts such as amniocentesis. 13. Confirm an intrauterine death. How to prepare for a pregnancy ultrasound. In order to get a clear image of the fetus and your reproductive organs in the earlier parts of the pregnancy, you may need to have a full bladder during your ultrasound. You should drink 2 to 3 8-ounce glasses of water 1 hour before your scheduled ultrasound. You should not urinate before your ultrasound, so you arrive at your appointment with a full bladder. To perform a pregnancy ultrasound, you'll be instructed to lie down on an examination table or bed. An ultrasound technician will apply special gel to your abdomen and pelvic area. This gel is water-based, so it should not leave marks on your clothes or skin. This probe will rest against the back of your vagina while the images are captured. The technician will check to see if the necessary images have been captured and are clear. The gel will then be wiped off and you'll be able to empty your bladder. Fetal echocardiography. A fetal echocardiography is performed if your doctor suspects your baby may have congenital heart defects. This ultrasound captures an in-depth image of the fetal heart, one that shows the heart size, shape and structure. This ultrasound also gives your doctor a look at how your baby's heart is functioning, which can be helpful in diagnosing heart problems. This test may be done in a similar manner to a traditional pregnancy ultrasound, but might take longer to complete. Objectives of prenatal care. Prenatal care is a regular medical and nursing care recommended for women during pregnancy. Prenatal care is a type of preventive care with the goal of providing regular checkups that allow doctors or midwives to treat and prevent potential health problems throughout the course of the pregnancy, while promoting healthy lifestyles that benefit both mother and child. Prenatal care generally consists of a monthly visit to the health care give during the first 2 trimesters from week 1 to 28. B. Fortnightly visit to a doctor from 28 weeks to 38 weeks of pregnancy. C. Weekly visits to doctor after 36th week till delivery. Delivery at week 38 to 40. D. Assessment of parental needs and family dynamic. 1. To promote and maintain good physical and mental health during pregnancy and through health education on hygiene, nutrition, etc. 2. To promote an awareness of sociological aspects of childbearing and the influence this may have on the family. 3. To build up a trusting relationship between the family and the caregiver. 4. To monitor the progress of pregnancy. 5. To reduce maternal and perinatal mortality. 6. To recognize deviation from normal and provide prompt management and treatment as required, or referring the woman to appropriate health team. 7. To ensure that a live and healthy baby is delivered at the end of pregnancy. 8. To help and support the mother in her choice of infant feeding. 9. To offer the family advice on parenthood. 10. 9. Take 2. 9. To offer the family advice on parenthood. 10. Providing a holistic approach to the woman's care that meets her individual needs. Process of prenatal care. At the initial antenatal care visits and with the aid of a special booking checklist, the pregnant women become classified into either normal risk or high risk. Prenatal diagnosis or prenatal screening. Note that prenatal diagnosis and prenatal screening refers to two different types of tests. Is testing for diseases or conditions in a fetus or embryo before it is born. Obstetricians and midwives have the ability to monitor mother's health and prenatal development during pregnancy through series of regular checkups. Process of prenatal care. Booking. Women are encouraged to start antenatal visits as soon as pregnancy is suspected or they miss their menses. This is necessary to confirm pregnancy and plan for appropriate care. To ascertain baseline data of vital signs, blood pressure, blood values, urinalysis, and fetal well-being. Process of prenatal care. History taking. This is not just for record keeping alone, but also assesses the health of the woman. Great patience is needed when taking history of a new patient, especially a prime gravidal. Patient must be prepared to give accurate details of herself. A. Gain her cooperation. B. Provide privacy. C. Ensure friendliness and kindness. D. Ask direct questions. E. Do not help her to answer the question. F. Use simple, non-technical language. History is taken in the following areas: social history, family history, medical history, surgical history, obstetric history, previous pregnancies, labor, puerperium, baby's history, history of present pregnancy. Advice to the pregnant woman. This should cover hygiene, recreation and exercise, travel, rest and sleep, suitable clothing, bowel care, care of the teeth, breathing, smoking, marital relationship, care of the breast, drugs, diet in pregnancy, and necessary foodstuff nutrients. General examination of the antenatal patients. These are as follows: the neck, upper limbs, the breast, palpation, and advice. Advice should cover the diet. Prepare patient by ensuring she empties her bladder, and physical examination progresses from the head, eyes, ears, nose, mouth, and face. Patients with abnormal findings are referred. All findings are recorded in the patient's antenatal notes. Routine drugs are given. Appointment is given for the next visit as a thorough explanation is outlined to this effect. Investigations recommended. Blood test, urinalysis, and ultrasound. Ultrasound is most commonly performed during the second trimester at approximately week 20. Ultrasound are considered relatively safe and have been used for over 35 years for monitoring pregnancy. Among other things, ultrasound are used to diagnose pregnancy, uncommon, check for multiple fetuses, assess possible risks to the mother, e.g. miscarriage, bleated ovum, ectopic pregnancy, and or molar pregnancy condition. Check for fetal malformation. Determine if an intrauterine growth retardation condition exists. Check the amniotic fluid and umbilical cord for possible problems. Determine due date based on measurements and relative developmental progress. Generally, an ultrasound is ordered whenever an abnormality is suspected or along schedules similar to the following: 7 weeks, confirm pregnancy, ensure there is neither molar or ectopic, determine due date, 16 to 20 weeks, see the expanded list above. 34 weeks, some areas, evaluate size, verify placental position. Therefore, caring for a woman in pregnancy involves physical care and psychological support. It requires collaborative effort of the nurses, midwives, and doctors. Careful examination during hospital visits will help to monitor the progress of the pregnancy and maintain a good state of health of the mother and the baby. Good history taking serves as a parameter on which other assessment and evaluation will be based on. It is therefore necessary that a pregnant woman books early so that the necessary care is obtained. She should be encouraged to attend antenatal visits regularly. Study section summary. In this study section, you have learned that 1. Antenatal care is part of a preventive care which aims at maintaining physical and mental well-being of a pregnant woman to ensure life and healthy baby at term. It prepares the family psychologically on how to cope with the demand of childbearing. 2. The process of antenatal care is in 2 parts. Booking a comprehensive history is obtained from the women who covers social, medical, surgical, obstetrics, and baby of previous pregnancies. This is followed by thorough general examinations. 3. The subsequent care is based mainly on assessment of progress of pregnancy, and any problems that may crop up and prompt treatment is given. End of study section 13. Thanks for listening.